We have now highlights coming in from the Global Indian Physicians COVID-19 Collaborative virtual session, which was hosted by the Global Association of Physicians of Indian Origin, GAPIO. This collaborative has been fostering a system of learning to arrive at the best possible approach for the prevention and management of COVID-19, encompassing everything from vaccination to strategies, and is being attended by more than 3,500 doctors and 40 countries. Recently, a collaborative virtual session was held titled Therapy for COVID, When to Use, When Not to. Attending the virtual event were top South Asian medical doctors from all across, including ITV Go's chairman Padma Shri Dr. Sudhir Parekh.
Welcome to GAPIO COVID-19 webinar. It's a very successful webinar for last 2 months, and really the physician all over the world has enjoyed this webinar very much. It's my privilege and pleasure to introduce Dr. Pawan Bhattraju. Dr. Pawan Bhattraju is an assistant professor in the Division of the Pulmonary Critical Care and the Sleep Medicine at the University of Washington. Dr. Pawan is part of the group who was pioneer in publishing US COVID-19 cases in New England Journal of Medicine early enough. Dr. Pawan is also co-principal investigator in study where they collected biological specimens from the very ill COVID-19 patients to understand the molecular mechanism of the disease. Let's welcome and hear Dr. Pawan Bhattraju. Welcome, Dr. Raju.
I'd like to thank the organizers for the invitation to present. This is particularly exciting because growing up, my father is a surgeon, and so we would attend OPI events often. And so it's exciting to be able to present to this group. I'm going to briefly be talking about the historical precedent of using convalescent plasma and the limited data currently available for this therapy. So on the left, you see a schematic of whole blood, and after centrifugation, plasma is the milky fluid that's found in the blood. This contains immunoglobulins as well as other factors. So the mechanism of action is to think that after someone is recovered from SARS-CoV-2 infection, to collect their plasma and then administer it to patients with COVID-19 infection to prevent or treat the current infection using the neutralizing viral antibodies. Currently, this is FDA approved in the US through an investigational and an emergency IND. Convalescent plasma for the treatment of infectious diseases has been used since the early 20th century and was associated with reduced mortality during the 1918 influenza pandemic, the 2003 SARS-CoV-1, as well as the 2009 influenza H1N1 pandemics. However, most of the published studies of these diseases were case series and retrospective comparisons of treated versus non-treated individuals. Despite this, because of the encouraging results, there's been precedence to use this in COVID-19. There's been a handful of different case series that have been published in COVID-19, but I really want to focus on the largest randomized control trial currently available. So this study was published in the Journal of the American Medical Association in June 2020. The investigators were from China, and the expected sample size for this study was to be greater than 200 patients. However, the investigators said that because of the pandemic was under control in China, they were unable to enroll patients, and so they stopped at 103 patients. Half of the patients were randomized to the convalescent plasma group, and half of the patients were in the control arm. As you can see from the Table 1 demographics, the average age was 70-year-old or older. And as can be seen in most case series of COVID-19, coexisting diseases, especially cardiovascular diseases, were common. One of the things to note about this, in the previous pandemics when convalescent plasma was used, such as SARS-CoV-1 or influenza, it was mostly used in a younger patient population and earlier during hospitalization. In this randomized control trial, each patient had an average symptom duration of 30 days or longer prior to getting enrolled in the study. So it was mostly used in a later in the disease. It's also important to note that many of these patients received other therapies, everything from antivirals, antibacterials, steroids, as well as antifungals. So it's challenging to know exactly if the results are due to convalescent plasma or from these other therapies. Their primary outcome, so on the left here is the cumulative improvement rate, is the percentage of patients who experienced a 2-point improvement or were discharged alive from the hospital. And so you can, as you can see from these two Kaplan-Meier curves, there is no statistically difference between the placebo group versus the convalescent plasma group. And then I just want to end by saying there's over 26 randomized control trials currently underway in, if you look at clinicaltrials.gov. And so I think there's going to be a lot more that's coming out about the use of this therapy.